afternoon. My name is Hilda Crespo from the Aspira Association. I am here with Christine Perez from the National Hispanic Council on Aging. As national organizations, Aspira and NHCOA have partnered to reduce HIV infections, promote HIV testing, reduce HIV stigma, and improve health outcomes for individuals. Today, we will focus on World AIDS Day, and we are pleased to be interviewing Francisco Ruiz, team lead from the National Partnership Team at the Prevention Communication Branch at CDC. Francisco, thank you for joining us. And Christine, I believe you have some questions for Francisco.
Yes. Thank you, Hilda, and welcome, Francisco. So in celebration of World AIDS Day, we have some questions, as Hilda mentioned, from the Hispanic and Latinx community and that we work with. So our first question for you is, if you can tell us a little bit about what is the purpose of World AIDS Day?
Yes, definitely. Thanks again for having me, first of all. It's always an honor to be with you guys. World AIDS Day, in HIV, we have a lot of different awareness days. So it's an opportunity to really kind of have a focused conversation. So World AIDS Day is commemorated every year, December 1st. It's actually the first global health day that was started in 1988. So we've been celebrating and honoring folks since 1988 around World AIDS Day. And it's a time to unite all of us together globally, support people with HIV, as well as to honor those who we've lost to, related HIV illnesses. And so it's a moment of reflection as well. And so this year's theme is really about making sure that we focus, given the fact that we're in this global pandemic right now with COVID-19, focusing on how we can strengthen and deliver quality, people-centered HIV prevention and treatment services. So World AIDS Day has a strong history around building the capacity of people living with HIV, the advocates, but also working with those who are delivering the services. So that could be the health department, organizations like yourselves, community-based organizations. And so really looking at how we do the work that we do in a better way, particularly right now in the midst of this global pandemic.
Great. Thank you so much for that. And can you tell us more about what is the impact of HIV in the United States?
Sure. So unfortunately, HIV and AIDS remain a persistent problem here in the U.S. and around the world, which is why we use these awareness days to really elevate the conversation and really focusing on our communities. And so for World AIDS Day, this is an opportunity for us to do some self-reflection, like I mentioned earlier. But we have had some progress both from the prevention side and treatment side. So that's something also to focus on and continue to see how we can make sure that folks have access to the prevention services and the treatment services. But in 2018, we saw about close to 38,000 people received a new HIV diagnosis in the United States. The annual number of diagnoses, though, I will say, has decreased about 7% from 2014 to 2018. So again, it's still a problem, but we were seeing some progress. And so we need to continue to see what are we doing right to continue to put some energy there, and how do we continue to see the decrease in our communities, particularly our Latinx community.
Absolutely. Completely agree on that. And how does HIV affect different group of people? If you can let us know more about that. Yeah.
Yeah, and I took some notes here because my numbers sometimes slip my head. I have a lot of numbers in there, so I'm going to reference some of the numbers that I have. And so, again, using 2018 as the basis, we saw gay and bisexual men and other men who have sex with men accounting for about 69%, so almost 70% of new HIV diagnoses in the U.S. and our dependent areas. That same year, we saw heterosexual made up about 24% of new cases. And if we look at by race and ethnicity, we see that Black African Americans are the most affected by HIV. And so they represented, again, in 2018, about 42% of new HIV diagnoses. For Hispanic, Latino, Latinx communities, we saw also disproportionate impact. And so we saw about 27% of new HIV diagnoses were among Latinx communities. There's also some differences in ages. And so unfortunately, our young people are disproportionately impacted as well. And so young people end up seeing that are between the ages of 13 to 24. we saw in 2018 about 27% of the new HIV diagnoses were among young people aged 13 to 24. And so the work that you guys do as an organization is really important to make sure that our young folks are getting the information. And again, among the young folks, it's not equally distributed. And so we see a lot of young so if we cut out the pie of the 21% of new diagnoses and just look at young people within 13 to 14, about 83% of that pool of people were gay and bisexual men. So again, even if we slice it by, regardless of how we do it, by general population, by race, ethnicity, by age, we are seeing, unfortunately, gay and bisexual men be impacted differently than other communities.
And also people want to know if the incidence of HIV is higher in different parts of the United States. What can you tell us more about that? Yes,
and so unfortunately there isn't a state or a dependent area that is not impacted by HIV. There's work that needs to be done across the country. But I will say that in 2018, again, as the basis, we saw about the South being the highest percentage of new cases, but followed right behind there is Puerto Rico and other dependent areas. And so our U.S. dependent areas are also disproportionately impacted. So we're putting a lot of energy there, making sure that our communities in Puerto Rico and other countries or in other states are in the South particularly are being adequately served in terms of resources, both funding and capacity. So those are the two kind of priority areas that we're looking at, as well as other jurisdictions that we've identified in an initiative that we call Ending the HIV Epidemic. And so we're looking at some of those dependent areas as well.
Excellent. Thank you for that, Francisco. So now I would like to invite Hilda that she has other questions for you. Go ahead, Hilda.
So what about HIV around the world?
So, oftentimes when we talk about HIV in the U.S., you focus on the U.S., right? But obviously we're part of the world. We're part of the global response. And so worldwide numbers that I prior to this conversation, I was looking at some of the numbers, and it's not looking great. We have about 1.7 million new cases of HIV. So 1.7 million new cases of HIV worldwide, and that's in 2018. And about 37.9 million people with HIV are diagnosed in, so that's, I'm sorry, let me backtrack. In 2018, we saw new cases, 1.7 million. Globally, collectively, as you accumulate, is 37.9 million. Of those 37.9 million people, 24.5 million have access to medicine and treatment. So that means there are substantial, about over 10 million people who don't have access right now. So that's something that we need to focus on as a community, as U.S. is working with our federal colleagues around the country, but also our global partners.
That seems pretty significant. What is CDC's commitment toward addressing HIV/AIDS?
So as I mentioned, we are working with our federal colleagues, making sure that we're connecting the dots and making sure that they are receiving the information both from the HRSA side, so our colleagues who focus on care treatment, but also CDC, who will focus a lot about prevention, connecting the dots with NIH. And so we're doing a lot of coordination with our federal partners, but also supporting the work at the local level. So the health departments, obviously the community-based organizations who are on the ground doing the work. And so we just recently announced some cooperative agreements with health departments and CBOs. And so collectively trying to see how we could address, again, the HIV epidemic, so ending the HIV epidemic. And so CDC awarded about $40 million per year for health departments to look around data collection, prevention services. We've also announced and awarded a cooperative agreement for $11 million per year for 5 years with our community-based organizations to look at young and bisexual gay men. And we also, one thing that I want to mention is we have what we call the Let's Stop HIV Together campaign. And so that's something that I know that Aspira and our other partners have been working with us on, is to make sure we amplify and make sure we get the messages to our communities.
Thank you. How has COVID-19 created challenges in these efforts?
So, there's a lot of focus on COVID-19, and rightfully so. We're seeing the cases increase even now, months into this pandemic. But people are still also at risk for HIV, and so that's been making sure that we keep our finger on the pulse, making sure that we're hearing what's happening in the community, but also still addressing the issues as it relates to HIV. And so we're working together around thinking through the work that we used to do in the past was on testing. Back in the day, we used to just do testing events, vans and show up and have folks come to your organization. Right now, we're leaning on new ways to kind of get the message out. So really working with virtual space, going to them in virtual spaces, also making sure we have telemedicine and telehealth available as it relates to PrEP, making sure that we work with community-based organizations around self-testing. So, we've always had self-testing, HIV self-testing, where people could buy and pick up or get through the health department or through CBO's self-test kits. Now, more than ever, it's important that we know that, make sure folks have that information. And so we're working with them on how they can do self-testing programs based on the need, given the pandemic, around social physical distancing.
Well, clearly, these are challenging times. However, as you noted, we can go virtual in addressing those challenges. At this point, I'd like to turn the interview back to Christine.
Thank you, Hilda. So that will be all for today. And thank you, Francisco, again for collaborating with us. And it's important to know that together we can stop HIV. Thank you. Gracias.